all. So I'm here today to talk to you a little bit about situations when the interpreter needs to interrupt their role as interpreter, uh, pause the interpretation, either to seek clarification or to um, recuse themselves from the interpretation session, right? Both these things are hard. Interrupting the interpretation session is hard because, as you'll see, there's a play going on during interpretation. There are actors and roles, right? You have patient, provider, interpreter, and the interpreter is not speaking for him or herself. The interpreter is in a role as interpreter, voicing the things that the other two people in the space are saying. And when the interpreter all of a sudden has to use their own voice to interject, they have to step out of their role of interpreter. That can be confusing. And to do it professionally, you have to tell everyone what's going on. So, uh, pausing is hard. Ending an interpretation session because the interpreter has reached their limit and isn't capable of professionally completing the interpretation for whatever reason is hard because nobody's going to be happy that that happened or like that, right? You are there in a situation where you are interpreting in order to help make things go smoothly. And in a medical setting, you're probably already in the room, right? And so the provider isn't going to be happy that the meeting is going to be interrupted or that the visit is going to be interrupted because the interpreter can't interpret for whatever reason. The patient isn't going to be happy about it. They may have to reschedule the appointment. There may not be another interpreter available. However, ethically, if you have reached the limit of what you are able to interpret, or if something comes up that means that there's a conflict of interest, or if the patient is incomprehensible to you because of the dialect or the vocabulary that they're using, or if you don't understand enough of what the provider's saying to ethically be able to convey the information, it is your ethical responsibility then to step out of the situation. If you are a provider, I think that you need to be aware of both of these situations. You need to be aware of seeking clarification and what that looks like, and you need to be aware of an interpreter reaching their limit and what that looks like. Because while it might not be ideal for you, you could see it, it could happen. And in that situation, even though it's inconvenient for you, you need to do what you can to aid the process, because what you don't want to happen is unethical practice, right? And so, to the degree possible, you manage the situation in that if the interpreter is trying to behave ethically and recuse themselves, or trying to behave ethically and seek clarification, you try to help that process along as opposed to hindering it. And that means understanding the process so that you know what to do to be helpful. So I'm going to deal a little bit with both today, but mostly I'm going to give you the process for how you pause and how you seek clarification and how you recuse yourself if necessary. Those of you looking at it more from the provider perspective, think about that process of doing either of those things and how you as provider can be helpful. So pausing an interpretation. There are a couple of reasons why you might pause an interpretation. You might pause an interpretation as the interpreter in order to advocate for the patient, to clarify that the patient has an intended meaning that is cultural, that might not be conveyed in just the words that were said, to advocate for the patient by indicating that even though the patient is providing responses, for instance, C, yes, that you don't see an indication that the patient is understanding, right? In which case you are pausing the interpretation to explain to the provider, to advocate for the patient, to explain to the provider sort of what is going on in the situation. That kind of pause. If it's cultural advocacy, fine, you may need to explain, the patient is talking about this particular cultural belief or culture-bound practice that you should know about so that you provider are informed when you're making, further suggestions. The provider, however, can be really helpful in avoiding the need for the interpreter to advocate for the patient in terms of comprehension, right? And one of the ways that the provider can do that is to ask regularly questions that ensure comprehension, right? So if you're talking about a treatment plan, for instance, the provider might lay out what 2 or 3 steps of the treatment plan are, and then ask the patient, can you can you tell me or repeat for me what you heard, right? And by doing that, you're prompting, without interrupting the interpretation at all, the patient to repeat back. Um, I heard this, this, and this. I heard take this medication 2 times a day. The swelling should go down in about a week. If it doesn't, I should come back here, right? And in that way, you allow everybody in the room to verify comprehension without having the interpreter have to step outside their role, and without leaving doubt about whether or not the patient is just responding in the affirmative because that's what's polite to do, right? So asking the patient to verify their comprehension of important information, particularly if it's related to treatment or informed consent, is something that the practitioner can do that will greatly simplify and improve the interaction with the patient. So practitioners, that is something that you can do to be helpful. Now, another time that we pause an interpretation session is if somebody says something and the interpreter doesn't know how to interpret it because they didn't understand the words or because they aren't sure what the words refer to. This can be frustrating to to both people in the room, but it can be frustrating to a provider, for instance, if the patient says something and the interpreter needs clarification because they're not sure what it is. If that happens consistently, you might have an interpreter who really isn't qualified to be running that session. But keep in mind that dialects are different and that there can be a lot of ways in Spanish, just like in English, to say the same thing, and that somebody from a dialect very different than the dialect of the interpreter, right? A patient with a different dialect might be using regional vocabulary, for instance, that the interpreter just might not be that familiar with, right? And so the interpreter might have a wide-ranging vocabulary and just not know what vocabulary they use in this remote area of Guatemala or, in southern Chile or whatever it is. And so to the degree that the interpretation session is still mostly flowing, what I would say to providers is to keep in mind that the occasional need for clarification of vocabulary or whatever isn't necessarily an indication that your provider is incompetent, for instance. However, again, if every other sentence requires clarification or repetition, that is a sign that something might not be going well. Okay. Okay, and so the way that goes is, let's say, for instance, the patient is describing some symptoms that they have, and they say, se me pone la piel de gallina. Okay, and the interpreter hears that and doesn't know what la piel de gallina is. Okay, so se me pone la piel de gallina would literally translate as I get hen skin. If we interpret it literally, that's not going to help the provider necessarily understand anything. So now the interpreter needs to pause the interpretation session to ask the patient to explain piel de gallina so that they can then explain the symptoms to the provider as opposed to using the direct terminology, or they can clarify what the direct terminology is and interpret that. But the interpreter can't just all of a sudden start talking to the patient because the provider is expecting an interpretation, right? And the minute that the interpreter is directly talking to the patient, they're not functioning as an interpreter anymore. So here's what needs to happen. I'm going to be patient. Bueno, se me pone la piel de gallina. Interpreter doesn't know what's going on. Doctor is waiting for an interpretation. So the first person I need to talk to is the doctor or the provider to clarify to them that I'm now going to interrupt my role as interpreter. So I'm going to turn to the provider and I'm going to say, the interpreter is going to seek clarification from the patient. Then I need to explain to the patient what's going on. La intérprete necesita clarificación. Now I can ask the patient for that clarification. So I'm going to say, ¿qué entiende usted? Or ¿qué quiere decir con piel de gallina? Right? And the patient's going to say, oh, cuando la piel se me pone con con burbujitas o con lomitas, como cuando uno tiene mucho frío, right? Now the interpreter knows that we're referring to goosebumps. So the interpreter is going to start with the patient. La intérprete vuelve a su papel de intérprete. And clarify for the provider then. The interpreter is returning to interpret or to the role of interpreter. I get goosebumps. Okay, so here was the sequence. Patient says something, provider needs clarification, or interpreter needs clarification. Patient says something, interpreter needs clarification. Interpreter goes to the person expecting the interpretation, which is the provider, tells the provider that they're stepping out of their role as interpreter for clarification, turns back to the patient, tells the patient that they are stepping outside of their role to seek clarification, asks for that clarification, receives the clarification, tells the patient, that's who they're talking to, that they're returning to their role of interpreter, tells the provider that they're returning to their role of interpreter, interprets in the first person. You can see why you wouldn't want to do that multiple times during a session, because obviously, it takes a lot of brain power to make all that shift. While you're doing that, you're losing the content and the flow of the interaction that was going on. It feels awkward for everybody else. The interpreter has to go out of first person to ask for the clarification and then go back into it. So not something you want to do frequently, but when you have to do it, you're going to do it. So from this point forward, when you do interpretation practices or activities, you are going to do it this way, right? So instead of just saying, what was that word? I don't remember that word. You're actually going to go through the process of interrupting the session, asking for the clarification, having the patient provide the clarification, and then go back to interpret. This can go the other way too. Let's say that the provider says, you have symptoms of AFib. And let's say that the interpreter doesn't know what AFib is, right? And the acronym AFib, or the shortened version AFib doesn't exist in Spanish that they know of. So now the interpreter can't interpret to the patient AFib because they don't know what the proper interpretation of that would be. So now it's the patient who's waiting for interpretation. So the interpreter is going to turn to the patient and they're going to say, la intérprete interrumpe la interpretación para pedir clarificación de el proveedor o el doctor o la doctora. Then they're going to turn back to the provider and they're going to say the interpreter is pausing the session to seek interpretation. Okay. Please explain AFib. And so now the provider is going to either say atrial fibrillation, right, where we have a Latin word, or the provider is going to explain what atrial fibrillation is. Okay. Once the interpreter has that information, either the word that they can take from Latin and turn into Spanish, and providers keep in mind that if there's a Latin-based word, give them that, right? Because they can turn that back into the language, whereas you give a paragraph-long description of what atrial fibrillation is, they have to hold all that in their head and then turn it back into interpretation. So if there's a Latin-based word, I would provide that to them. Also, to the degree possible, when there's an interpreter, avoid acronyms if possible, and avoid shortening terms, right, if possible. Also idioms, avoid idioms if possible because they don't interpret cleanly. Okay. So the provider gives the word for atrial fibrillation. The interpreter says, the interpreter is returning to interpret. La intérprete vuelve a interpretar. Usted tiene síntomas de fibrilación atrial. Then the patient says, ¿qué es eso? Right? Which could happen. The patient doesn't know what fibrilación atrial is. The interpreter says, what is that? Okay. Now the provider is going to explain, give a definition of atrial fibrillation, and the interpreter is going to interpret back, staying within the role of interpreter, which is why it's really important for patients to ask questions if they have them, right? Because otherwise the person leaves with the information that they have atrial fibrillation, but no idea what it is. And it's really important for the provider to seek clarification. So if the interpreter says, usted tiene fibrilación atrial, and the patient says, bueno, right? A good question for the provider to ask afterwards, if they want to make sure that their patient understands what the interaction is do you know what atrial fibrillation is? And then the interpreter can interpret, ¿sabe usted lo que es la fibrilación atrial? And the patient can answer sí o no. And if the patient says no, the provider then can explain what it is, right? So providers, you can be very helpful in ensuring comprehension during interpretation by giving the patient opportunities to express lack of understanding so that you can then explain. Does that make sense? And so now you've seen a pause. You've seen how a pause kind of works in a couple of different circumstances, and you can see why it's uncomfortable to do a pause, and I'm going to try to provide you with a little bit of structured practice for how you do it, but it's going to be awkward, and when you're interpreting, you're not going to want to do it. When you're interpreting, what you're going to want to do is not have a vocabulary word in your head and go, wait, what's the word? You're going to want to seek clarification right away from the person that you're talking to instead of interrupting, talking to the person in the other language about the fact that you're interrupting, talking to the person that you were originally talking to about the fact that you're interrupting, seeking the clarification, saying you're going back to your role, telling the other person that you're going back to your role, and then interpreting. You're going to want to resist that. But it is the ethical way to step in and out of your role without crossing role boundaries, right? Without becoming part of the interaction in a way that is inappropriate. Okay? So let's say that I'm in an appointment and I'm the interpreter, and every fifth sentence, I have to pause and ask for clarification because I just don't understand this patient's accent, right? In other words, when they talk, I can't make sense of the words that they're saying because I'm just unfamiliar with the dialect, or because they talk in a way that isn't clear to me, or I just don't understand their accent. I, the interpreter, then am in a position where I need to recuse myself from the appointment. And so what I say is probably first to the provider, but again, depending on how the situation unfolds, right? I'm going to say the interpreter has reached their limit and is recusing themselves from this appointment, right? La intérprete ha alcanzado su límite y va a dejar de interpretar para esta cita, right? Or whatever it is that you come up with. Again, this is like your interpreter intro. How you word this could go various ways, but what you might want to do is to have a structured message in your head that is what you will say in this circumstance so that it comes out when you need it, right? And notice that the interpreter talks about the interpreter in the third person, because you're not I in the interpretation session. The patient or the provider is I in the interpretation session because you're speaking from them in the first person. So when the interpreter talks about the interpreter talks about the interpreter in the third person, as weird as that is. Okay? Let's say that the doctor is talking about a thoracic surgery that they're going to perform, and they're talking about the techniques that will be used and how the surgery will be performed, and for whatever reason the interpreter maybe wasn't aware ahead of time so that they could study up on the vocabulary, or got thrown into a situation where they weren't expecting to be interpreting for a description of a thoracic surgery or whatever. The interpreter realizes that they don't have the vocabulary or the knowledge to explain properly what the provider is saying in the session, right? The interpreter again says, leaves the session. The interpreter is recusing themselves. The interpreter has reached their limit. La intérprete ha alcanzado su límite. La intérprete va a dejar de interpretar. Again, if you're the interpreter, expect that to probably cause some tension, right? Nobody's going to like that. Somebody might try to talk you into please continuing anyway. Somebody might get angry. The interpretation might have to be, or the appointment might have to be over for that day. They might have to go find another interpreter, which would be uncomfortable, whatever. Obviously, the ethics of interpretation mean that the interpreter works very hard not to put themselves into a situation that's going to be over their head in terms of interpretation, but one never knows. Dr. Tarp likes to give an example where she was called to interpret, wasn't a medical setting, but she was called to interpret I believe, in court. But the vocabulary that was used was farm. There were a bunch of farm machinery that was involved in this particular case that was being talked about. And she didn't know the terminology for the various kinds of agricultural machinery that were being talked about. And she had to recuse herself. The interpreter has reached their limit, right? The ethics of interpretation mean that to the degree possible, you prepare to go into a situation. You want ideally to know what the appointment is more or less going to be about. Is it a physical exam? Is it a pre-surgery? Is it a cardiac appointment? Is it a I don't know. Is it a physical therapy appointment? What is it? And then you would prepare by trying to know, is it going to be about the knee? Is it going to be about the kidneys? What are we going to be talking about, right? Do we know what disease? And then we can prepare for that. Right. So to the degree possible, the interpreter will try to get ready for the appointment. Couple things. A provider that knows they're going to be working with an interpreter, or a clinic that knows that they're going to be working with an interpreter, it is helpful to provide within HIPAA as much context as possible about what that appointment might touch on, right? And so the interpreter can make some assumptions based on where they're going, right? If they're going to the cardiac ward of the hospital, or if they're going to a mental health counseling center, they could make some assumptions about the general context of the appointment they're going to. But if it's possible to provide more information, like what body part we're talking about, or the fact that this is preoperative, or anything else that can be told to the interpreter ahead of time, all of that allows the interpreter to prepare better for the appointment, right? So again, within HIPAA and following HIPAA guidelines, whatever information can be given to the interpreter ahead of time, remembering that the interpreter is also bound by HIPAA if they're a professional interpreter in a medical setting, is helpful and will make things go more smoothly, right? Again, something that the patients are very unpredictable, and we can't control what a patient will say, but the provider can be helpful by avoiding idioms to the degree possible, things that we say on a daily basis that are just sayings in English. Those sayings oftentimes don't interpret or translate cleanly to the other language, and so avoiding just figures of speech is helpful. Using proper anatomical terminology, using proper medical terminology in terms of not relying entirely on shortenings of words or common acronyms for words, because acronyms, for instance, oftentimes don't have a direct interpretation, and what the interpreter should do is give the proper term, and then if there is an acronym in Spanish, provide that. But it's more helpful to the interpreter if you just give them the full wording, particularly if the wording is Latin-based, so that they can interpret that. So that's another way that a provider can be very helpful. And if you run into a situation where the interpreter is struggling, usually you're going to be able to see or experience that the interpreter is struggling, and the interpreter makes the move to recuse himself from the appointment, even though that's not ideal and is uncomfortable. And it might not make you happy, and you don't have to smile about it and tell them that it's okay. Respecting the interpreter's limit, I think, is an important thing that the provider can also do to ease the entire situation. The patient might be angry. Again, the patient is outside the system, so the patient is not under our control. But one way in which the provider can help to manage the situation is to just not escalate it, right? To not become part of the problem, particularly if an interpretation session goes south, which is awkward. Yeah, so that is what I would say to you about pausing and recusing oneself from an interpretation session. And remember, providers, what I threw in there about the provider's role in being able to help with clarification. I'm going to be honest, for my in-class students, we work on integrating all of this pausing and recusing into their classroom practices that they do. For my online students, it's hard for me. You do 3 consecutives over the course of the semester, and so in those circumstances, you can practice this pausing and recusing, but it's hard for me to come up with good exercises to sort of work this in as a regular part of your life. I'm going to try to come up with a way to do that as a sort of using probably the Moodle quiz function to give you some practice. It won't be a quiz, but it'll use that Moodle quiz format, and I'll probably have you in video sort of practice recusing yourself or practice asking for clarification. You might have to practice with things that you actually could interpret, but you're just going to pretend that you don't know what they are, right? But what I would like is for you to have to go through that process a couple of times because, like I said, it is awkward and it is uncomfortable, and the only way to really get over the language hurdle of having to do it is to practice it, right? So I probably will try to create some kind of structured practice for you to do that in your consecutive interpretations. I'm going to encourage you from this point forward, if you need clarification on a term, or if obviously I don't want you to recuse yourself, but if you need clarification on a term, you're going to try pausing the session, asking for the clarification, and receiving it, right? For the purpose of our consecutive activities, even if you don't feel super competent as interpreter, we're going to have you continue to interpret anyway. All right? Okay. I hope you have a good rest of your week.